Thank you for joining us live with Miami's Community News. And our guest today is Dr. Erica Nelson. You are a physical therapist.
I am.
And today we're going to talk about the things that ail us all the way from our toes.
From our toes to our head.
All the way up.
All the way.
So we want to go over some of the things that you have done. You have your doctorate in physical therapy.
Yes,
you have a master's in science, sports medicine.
Sports medicine.
And you are an athlete.
I grew up dancing, not an
Yes.
official competitor, and then I cut my Achilles tendon, and that's why I'm doing what I do, because I couldn't dance.
And what, dancers are athletes.
Yeah, I know that. I was gonna kill it in New York, but now my life is I am here to help people
And you're also
with their problems.
And you're an adjunct professor.
I am. I teach at Miami-Dade Community College, and I teach in the sciences, biology department. I'm an adjunct faculty. It's very important to stay connected to our students.
Yes.
And because they need faculty who cares.
And people want to know that there's lots of folks when they're young, they continue their college education, they go 4 years of college, and they go to graduate school, and then they go out and work. Some people take off a couple of years in between.
Yeah, that's what I did.
So what did you do?
Well, I was a house arrest probation officer for the state of Florida until about 2000.
A probation officer.
Yeah, it's very related. That's a story. It's its own novel, but it is related. And I decided after my divorce, I'm going to go to get my master's. And then I moved away, and I spent 3 years in Savannah at Armstrong. And then I moved back, and then I worked several years in the Pilates field, applying all the biomechanical principles that are slightly different. And then I was like, yeah, I'm going to be a physical therapist. So I basically quit working because my cases and patients became more complicated, and I needed the language to help them.
So here you are, a young lady. You're a physical therapist. Your office is in on
I'm lucky.
US 1.
Pinecrest. Yeah, Pinecrest. I'm very happy.
Yeah, that is terrific. And the name of your company is the High Heeled PT Lady.
Yes.
And that's sort of an odd sort of name, but there's a reason for that.
Oh, there's a reason.
Okay, so tell us about that.
So the high heel for mostly women.
What is that right there?
This is my new model, my foot. Now it's not in a high heel position, but I brought it. Where should I?
That's good. Here, give me the bottle of water. A second. Okay, that's right.
Okay. I got this model, so I wanted to explain to patients why our foot can be so easily injured, but yet so heavily influence our everyday biomechanical, our pain, less pain. It's about the foot because it hits the ground running, and I'm going to help them with that foot.
And lots of people break that little toe.
Yes.
And just that little tiny thing, essentially there's no treatment other than some tape maybe, but that can affect the way people walk and then the rest of their body.
Oh, yes. There's walking is actually one of the most complicated actions that we do as humans. I mean, we do a lot of stuff, but biomechanically, walking is beyond complicated. So I break it down. And yes, if they fracture the fifth metatarsal or the fifth bone, all movement forces needs to go through the first long toe and the big toe, the first long bone.
Yep.
And what you're talking about on the fifth bone is really a laxity, a weakness in the tendons that are on towards the outside placement of the foot. So it's really the tendons that are not strong enough.
So, and speaking of feet and heels, all right, lots of people as they get older, like Tommy over here, all right, it gets what's this muscle that's here on Achilles?
Well, there's 7.
There's 7.
But commonly, most people really understand that it's the gastrocnemius and the soleus, right? The gastroc is the one you do with your legs straight, stretch, and then you bend your knee to stretch. But there are actually 7 muscles on the back of the leg.
So when people get plantar fasciitis, which is
that's very common.
That's very common, especially over the age of 50. And for our viewers, try to explain what that is, so people can understand how they feel and what has occurred.
It's a gradual deterioration or quality of muscle fiber and fascia. And it can really impact people's quality of life, because when you get up in the morning and you hit your foot, or you go through the whole day, the bottom surface is just miserable.
It's sort of like a rubber band stretched, really.
Right, but there are so many layers in the foot of small muscle, but so many tendons and ligaments. And because the bottom surface is used, it's the tissue on the bottom of the foot is so weak from not being contracted and strengthened. We just think like our bicep and our lats is important, but the muscle on the bottom of the foot needs to work as well. It really needs to contract.
So what's the muscle on the back end side of the heel up here?
These are tendon. These are ligaments.
What about right there?
This is the everybody talks about the Achilles heel.
Yes.
Yeah. This is the Achilles tendon, and it's the culmination of 7 muscles that come through the tendon.
And so right there, where a lot of people have a problem,
Yes.
all right, it gets really stiff.
It does.
And then it pulls
but
on
it's
the calf.
painful.
Yeah,
it's very painful.
I've heard that. Yes.
Yes.
And
I've been fortunate.
So here we are in the basic human function, which is walking, all right, and perhaps running, where you can have the plantar fasciitis, you have Achilles heel, and tell us how, when you're limping, how that affects the rest of your body.
It displaces every joint. The line of gravity comes through every joint in our body at a certain diagonal. But because our foot hits the ground first on our heel, that line of gravity, the forces, travel all the way up into the skull and the jaw.
Right. So you're an expert in this. You've been doing it a long time. You've been in private practice, right? You've made
Yes.
that decision. You're not working in a hospital setting, and people can go to you. They can find you on the internet. That is, again, the high-heeled PT lady. And you're going to find some really neat pictures of you.
Yes,
on there.
and working with clients.
Yes. So you have many years of helping people with Pilates. Explain for the people that don't know the basic foundation of the machine and how it helps people with the proper guidance.
Joseph Pilates created or designed his own equipment. And the best part of his equipment is the fact that it's geometrically squared, elongated, rectangles. It's all these geometric shapes that helps me and other teachers like me see the imbalances, whether that's in the foot, the ankle, the body, right? And we can work off that geometric shape.
When you see somebody for the first time get on this machine, which is, I'll use the term loosely, like a rowing machine, in the sense you sit on it, all right? And you use your feet and your hands, and it's spring operated, and you set the right intensity or lack of thereof. When they start operating and start moving, you can look at them and say, I see you have a problem with whatever.
Actually, when they walk in to see me, I already know.
Right. So
I mean, I can see what the compensation pattern is.
And I think that's part of what we all do. It's like, okay, so if you can't read at night, you figure out something else. You hold a flashlight,
right?
Or whatever.
Compensation.
Yes. And
path of least resistance.
Yes. And we've all sort of done
path of least resistance.
We've all sort of done that. Now, with Pilates, how long have you been involved with Pilates, and how long have you been teaching Pilates?
I've been teaching Pilates for 20 years.
So when people hire you to help them feel better, because that's why people are calling you, they're hurt and they want to feel better, and they may develop this, I really want to improve. So it's not just the absence of ill health, but it's a sense of good health with that.
Right.
So when they're on these machines and you're there and you're talking to them and they start hurting, what is it you say to them to encourage them to do better?
Sometimes things are going to get a little worse before they get a little better. When you start working with compensation patterns, because they call me for their foot plantar fasciitis, it's a whole body approach. They're a whole person. The reason they would call me is because I care about them as a person. I don't just care that it's the foot. I care that it goes through and it causes whatever dysfunction for them.
I might have shared this with you before. I was going to a dentist. He was working on one of my teeth, and he retired. So I went to a new dentist, and I said, listen, I got this problem over here. He says, I understand that, but let me take a look all around.
Right.
And within 5 minutes, he says, you have a problem over here.
Yes.
I said, I've been going every 2 months to the dentist over here, and he didn't look over here. Michael, that's what happens. We focus on that thing and we forget the rest of, in this case,
Right.
the rest of the body. Right?
Correct.
Now,
Correct.
when somebody calls you on the phone and they say, Dr. Nelson, I need some help here, and you have them on the phone, and what's that conversation sound like with them?
Well, they're going to ask what I can do for them. And really, it's about them as a person and as a solo practitioner, the privacy and the attention. And they are going to know after their first session, like they're going to walk in and they are going to know after their first session that they feel a difference like that for sure. Because we do if it's in their foot, if it's in their knee, if it's in their jaw, depending on what the treatment is, by the time they walk out, they're going to be understanding. They're going to feel it. They may not be able to describe it, but they can feel it.
And we all know when we go and start whatever it happens to be, signing up for school or getting in the sport, you know, when you go a time or two and you go, oh, and you can sort of feel it, that the endorphins are going, I'm taking care of myself, I'm doing this, somebody understands. And I think that's what people want. They want
Yes.
you to grasp what they're suffering with, right?
Right. In our third-party payer system, that's the first thing people always ask me. Do you take insurance? And I do not. I do not charge astronomical prices. I charge a fair price for my work, but they are going to get the attention that they need in order to change what's compensating.
There are, and in the personal training business, you can go to a great big gym, you can go to a
Yeah.
small gym, or you could go to, they only have 3 people maximum in the place, and you have your own personal trainer that's there. And so in this case, it's you and them. And
That's it. 510 square feet.
Yeah. And you don't have to be wondering about, gee, I'm going to be over there lifting some weights. And it's like, you got to put all that stuff out of your head.
No, and in this day of COVID, or post-COVID, during COVID, between patients, they're going to know that because I have my own studio, that they are safe.
Yes.
They are safe and they don't have to worry.
And by the way, folks, we really have a piece of glass here. I know the people, when they're out there, they don't see a piece of glass.
Oh.
They see a little trim that's here,
Oh,
but there's
okay.
a piece of glass that's here. So people can have, I see our guest.
Oh, okay. This is one of my patients.
Here, come on in. Why don't you have a seat? And we're going to be right with you.
Great.
Okay.
Hi.
Hi.
How are you?
Good.
I'm so glad you came.
All right. So one of Dr.
She's gonna
Aaronson's-
test you what
one
I
of
can
Dr.
do.
Nelson's patients is here. She's going to talk about your experience with Dr. Nelson. So somebody's going to go to you, and they're going to feel that you're there, you're taking care of them, that you asked enough questions to figure out what's really going on and the things that are the most problematic for them. All right. And we know lots of people have problems with their knees over the age of, depending.
Just general
Some over the age
crankiness.
of 20. And it's common. It's very, very common. I didn't realize how common that is. So somebody calls you up, they say, listen, Dr. Nelson, my knee is hurting me. All right. So what might be these questions that you would ask them along the way?
Well, do you play sports? Are you athletic? Are you sedentary? What's your diet like? What's your daily, average week look like? I mean, have you had any injuries? What am I dealing with? Do you have any systemic problems?
And in that I'm sure.
But then I always ask, can I see your feet?
Yes.
I really want to see your feet. Like, can I see your feet? I just
Folks,
want to
go
see
to
your
her
feet.
website. You'll understand.
I just want their feet. That's all. I want their feet. And they're going to leave the first session like, okay, I'm right. I'm coming back.
So we know that when you measure people and you look at their blood pressure, not that you do that, but all the other stuff, when you look at those things, what is going to occur. So if somebody was a marathoner for 25 years, all right, you probably know most of the stuff that's going to happen.
Right.
All right, to them.
Their
right?
Achilles tendon and plantar fasciitis is going to come and go, but it's going to be a lifetime thing.
Yes. And so you're able to work with them individually.
Yeah.
And to be able to walk them through. All right.
I teach them how to take care. Like these are foot wakers. These are your friends.
All right. So
These
you
are
put
your
that
friends.
you put that on the ground.
Yes. I want them to be all over the foot wakers.
All right. What do you call them?
They're called foot wakers.
Foot wakers.
Yeah. Yumuna, foot wakers.
And so when people put their feet, what does it do?
Well, depending on how sensitive your feet are, they it's sort of like reflexology, but magnified exponentially.
Because it's sort of, and if you will, when the acupuncture's, people started doing it in the 60s and 70s.
It's
I
sort
know
of
they've
like
been doing it for hundreds of years, and I've used that before. It's like, oh, wakes you up, and you got all
No,
this little things.
You've not used these before.
Well,
Have
whatever
you
it
used them?
was.
Oh.
All right. It was a thing that had.
Oh, I see what you mean, like a ball or
Yeah,
something
and
like
you
that.
go, oh, look at that.
No, these are special.
All right. We have special people today. Okay,
Special.
so let's see what else we have with reduction.
Oh, we have a pinwheel.
Okay.
Because this Joe talked about breathing, and probably today most people don't breathe.
Pilates.
Joe Pilates, like past their neck, especially in post-COVID. But pinwheel, they're so much fun, right? They're really a lot of fun. So I judge a person's ability to breathe just based on the piece of fun when we were kids. It's really great. Like it's the best tool. And watching them tells me if they're breathing, how they're breathing, how chest expansion, displacement, how solid, how long.
So all these things help create a map.
Yes.
For the things that you need to try to help them.
Yes.
Let's see some of the other things you have.
Okay, so these are everybody has these, right? These are.
Oh, yeah.
Yeah, these are the best, right? They're the best. So people think, oh, I'm just going to do something like for quads or hamstrings. No. This is put around your ankles, whether you're in clams or straight legs, standing up. You could stand up on this block too. See, I brought this block. See, we put the foot.
Looks like Miami 1980
on the block. Put the foot on the block, and then you're working for the stabilizers in the hip, because the foot talks to the hip.
And as you get older, I know people's stability sort of shifts. I've had some of those moments where I've gone, I don't have the stance anymore, all right? And you have to be able to balance it. And all that is right over there when you look at it. How's all that working? And these, what do you call these bands, all right? And different
Versaloops.
What do you call them?
Versaloops. Not TheraBands, Versaloop. They have a proper name, but I just call them whatever.
And is there a green one too and a white one?
Oh, there's all kinds. Like I brought a black one.
So let me see.
Like
when I see the red one, do I?
No, this isn't as heavy. Like I have a peach one that's triple X. I have pink that's, but a peach one that's triple X. Right. Extra heavy. And it just depends on what they need. It's what they need, because two patients are not the same. They don't have the same map, because when they come in, their feet are different for whatever reason. The principles of their biomechanics are the same.
So some people, when they're in an accident or they have surgery, they go to their MD. The MD says, go to physical therapy. You go a few times, and I've been to a few of them, and it's this what do you call it? Production line.
Yes, it is.
And you're looking around, you're going, oh, jeez.
Yep.
Barely,
quality of care.
All right.
Quality of care is not there.
And you're barely a number, and you're watching it. And so it's sort of like group therapy versus one-on-one.
Right. But that's not the only problem. There is a lot of unethical billing in Medicare and third party. And ethics are where I stop.
Right. So you were a dancer?
Dancer.
Right? You've been teaching and doing Pilates for
20 years.
20 years.
Been a physical therapist for three and a half years.
You have a master's in sports science,
sports
medicine, and a doctorate in physical therapy. So you know what you're doing. And you went back to school at a much
a non-traditional age.
Is that what it is?
Non-traditional student.
It really says something about your commitment to yourself and to the community that you would do that, because there must have been something that you saw in the community or yourself.
Well, patients I kept attracting like people that were in very complicated mechanical problems for long periods of time. And I needed the language to help them.
But there was a show I think it was on 60 Minutes or 48 Hours, about this football player who essentially his leg was broken in about 4 places, right?
That's possible.
And they showed his progress. And he actually played a couple of games. When he got better, then he figured, well, I'm good. I'm going to get out. And it was the physical therapy that made the difference.
Yes.
It was that commitment by those folks, all right? And this was, he was at the hospital for veterans who had their legs and arms removed.
Yes.
All right, or blown
That's a wonderful organization.
Yes, and so when you see that kind of commitment, all right, so he could go and he could live his life again, even though we don't have those kind of horrific problems, we do get arthritis, and we tear meniscus, get arthritis. Do I have some of these right? Arth-
Well, she
all right,
has a she has a different
and
situation.
I think we're
Yeah.
gonna find out a little bit about that in a few minutes. So again, so what is that the device with the black leather thing?
This is the patient's friend. Because this goes on the big toe. It's called a toe gizmo. It really is called a toe
The
gizmo.
toe
And
gizmo.
Joe Pilates created it. And all it does is it puts the foot in perfect alignment and ensures that it's perfect alignment so I can work on their foot. Do you understand? I keep going back to the foot. This is what is going to change because of all the things that they need, including their very fun pinwheel, because they're going to be breathing better.
By the way, we know when athletes line up, whether it's a football game or tennis or runners, all right, there is the position. This is your position, all right? And this is where you're going to start from. And if you can't balance yourself there, just forget it. And when we see, I watch runners a lot. When you see them, all right, do that. And in that perfect technique, all right, and you see them going around. It was Joe Waddle in the 1980 or so. I'm sorry, I don't have the exact date of the Olympics. He was a top runner. When he had a problem, when he took off, though, he was the last one, 800 yards, last guy out of 25.
And he finished first.
Yes.
Of course.
All right. Because
he probably had a great physical therapist.
Right. Because he knew the technique. All right.
Yes.
And if you ever watch boxing, amateur boxing in particular, as soon as they get out of technique, they lose.
Correct.
All right. You got to keep that.
The quality of life for patients, they need to return to what they love to do.
And we're going to have a nice young lady come over here, and you're going to sit right over here. I'm going to go right over there, and you guys.
And you're not leaving us, right?
No, I'm going to be right over there.
Okay, don't leave us. Okay.
All right, all yours. Take it away.
Hi there.
Hi,
It's
how
so
are
good to see you.
Nice to see you too.
Okay, so can you introduce yourself and tell them how you know me, please?
My name is Alina.
The camera's right there.
Okay.
See yourself? It says
Yes.
on air.
Why don't you move a little closer?
Okay.
And then after that, you can talk to her. It's all good. All right.
It's all good. You look great.
My name
So
is
does your spine.
Yeah. My name is Alina Klein. I'm a patient of Erica. I originally went to her because of back pain from scoliosis. I work out a lot and I'm 62 years old. I feel I'm very fit, but I didn't go really because of the way my back looked. I went because of the pain. And when I started going to her, the pain went away and I looked a lot better. I don't know.
So tell them about the foot wakers.
Okay, my
The
foot
foot
wakers.
wakers.
The foot wakers are the best because
Okay,
you put your which one do I look? I don't know which.
Right. No, right there.
Okay.
You can look at that.
Okay. The foot wakers I think are the best because like she said,
They
your
wake up your
feet-
foot.
No, the feet are the ones that hold your knees and your
Pelvis.
and your hips up. And somehow I have no idea how it straightens you out. And when you leave the session for a couple of days later, something happens when you're starting to go like this that automatically, at least it happens to me, I align myself. So she's great. I'm very stingy with my money and I'm like, oh my God, I need to go. My husband's, but that's how I feel. I love her because she makes me feel good. And then on top of that, you look better. So, that's it.
Okay. So I want to thank you for coming. And I want to thank you
inviting me.
And thanks for being my patient. And
Wait, hold on.
Wait, okay.
We're gonna share a little bit of it.
Okay.
Okay.
All right, Tommy, we good? Is this microphone okay for both of us? Or should I? Here, I'll do this one here.
Okay.
All right.
That's a microphone.
This
Yeah,
is
that's
a
a-
microphone. All right. There we go. Okay, so tell us how you met Dr. Nelson.
I met her through a friend of mine, a mutual friend of ours, and my friend had a surgery, a shoulder surgery, and she kept saying, "Oh my God, this lady is great." And I go, "You think she can help me with my back? Because I'm getting like a lot of back pain. I'm a realtor, and I'm always driving, and then I get my stress here." So that's what I did. I met her through a friend.
And so you had mentioned you go there and you feel good, and all of a sudden, a couple days later, you realize, okay, you're starting to bend over. But then you think about it and you go, oh,
No, I don't even think it. Something like muscle has memory or something. I don't know. I don't know if it has to do. I don't know.
One of the things we know about the muscle memory and about defaulting to a state. So I think part of it is to default to this state rather than default to this state.
Correct.
I guess. Yeah. That's
And when we look at folks that are in the armed services, all right, you know what their default is? Their default is
Yes.
straight up like this, and the default on their beds is perfect.
Right.
The default on their shoes is
but not
perfect.
only the outside. It doesn't. You don't feel the pain because I had a lot of pain here. Not only just the looks. It's like
So many of us think getting treatment for the things that ail us, we just go until it's okay. But the reality is, every day I brush my teeth a couple times, all right, and so it is with this type of work.
yeah, with your toes. Since we're only 25, after that 26, your little toe, your big toe, you don't realize it. It starts going different ways, and you start getting like, ugh. And this thing, oh my God, like I believe in it. I really do.
And then
100%.
when you go to an expert, a professional, who reminds us about the things that we are supposed to do and helps you
Yeah.
to do that. So other than you're feeling physically better and emotionally, how has that affected your family?
They like it
Because
because I don't complain. And oh my God, my feet feel so good. Like I didn't even know I had foot pain until this pain went away. You know what I mean? Like,
yeah, the greater pain theory.
yeah, because
Absolutely.
this is like
Goes back to
trying
the foot.
defy gravity. I think it's
That's
defy
right.
we're all
Line of gravity.
going the way that it's going.
So interesting.
Down.
Now, I know a lot of women at some point or another wear very tight shoes. Right?
Right.
A couple days ago, I said it's time for some new shoes. And, I went and got these shoes the second day, and it's completely changed. I
Yes,
think
your posture.
Yes, 100%. And it's like,
And you haven't
100%.
even got to see Erica yet.
it was like,
Right.
holy moly, that little thing about somebody reminding us about the things that we need to do. And you're there as their coach and mentor as far as getting better, right?
Right.
Again, my hat's off to extraordinary people like yourself who go to school at what did we call it?
Not so, a little older.
She's very hands-on also. Like really hands-on.
And I'm glad you brought that up. Years ago, I go to my cardiologist and I'm feeling bad. He goes, I'm laying down. He goes, "What's going on?" I put his hand on my shoulder. I said, "Just by me being here, I feel better."
You see, yeah, the
Right.
bedside.
Yes, because we want to know that somebody's there, whether it's for
Who
10
cares?
minutes or an hour, that cares, right?
And the nose too, because she's very, very knowledgeable.
There's a gentleman that came in where we were doing this series on mental health, and he had 10 years ago, he had a schizophrenic break, and he talked about what it was like, right, for him. And he wrote a song, and he wrote the music to it, and he sang it. He said, "Where you're sitting," and the name was "You're Not Alone." And he sang it. I was the mother, and I'm holding her hand, and we're both crying like little babies. But the point there is when he's singing that, I'm imagining walking down Brickell Avenue, all right, hallucinating with no shoes on, wondering where he's going to go. And so no matter it's from being schizophrenic or having a loving family, we want to know that there's somebody else there that can help us feel better about ourselves.
Yeah.
And as you mentioned, this is not just for you. You may go just for you, but the reality is it affects everything.
Right.
and
It
whoever
permeates our lives.
Yeah.
So what is it like knowing that you've helped so many people?
That's why I do what I do. It is calming. Brings happiness. It's what I do for people. It's how I change their lives that allows me to be part of their life and part of their happiness to help them.
So I can see that that's a really emotional issue for you. All right.
It is.
And you're passionate about it. All right. And so can we talk about that for a second? All right?
Sure.
Because this is the time when the truths
Oh,
come out.
right.
This is the time of a connection that people want. All right. What does it mean to you that you've helped her and so many people deep inside?
This gets a little complicated.
Yeah.
Helping somebody out of pain is the best feeling. To be part of their lives, that's what
Oh.
I do. That's me. Okay.
So years ago, I used to be in the health
Right, she made me cry.
And 40 years ago, I'm driving down the street with a friend, and there was somebody that had a flat tire. I said, "What, friend?" And I stopped and changed the tire. He said, "That made me feel really good, Michael." I said, "Well, me too. Guess what? I get to do that every day."
Ah?
All right, in the health
Wow.
arena, right? So I
Wow.
get it, all right, and to see your patients getting better and knowing that it affects the husband, the wife, the children,
It
the
does.
grandchildren, it affects everybody. It affects the people at the grocery store.
It
you go
affects
to.
the healthcare system.
Yes,
It changes what happens.
and with COVID, that certainly our healthcare system certainly been under attack, all right, for a long time, and there'll be lots of changes that we're going to see. But when people go to see you, all right,
It's just them.
and I think that's important for us to understand that now, all right? Probably more than ever in our lives, all right? And I know some gyms, there's 30, 40, 50 people in it all sweating and spitting on each other. Not on purpose, but it's what happens, right?
It's what happens.
So you have private sessions, all right? It's
Yes.
just them, all right? Sort of
Just
like being in
them.
therapy.
But I separate
but
them
I-
now by 15 minutes because I need the time
Right.
to prep and clean the room.
But
Okay.
this is also for the person, because I go to the gym, I go to spinning
Yeah.
classes. This is completely different. This is like localized areas that you need. That it's not. Of course, I want to lose 10 pounds, stuff like that. It's for movement, for I don't know.
So it's sort of like
It's
when the kids
freedom.
are in school,
Freedom.
so you have them in class, and then you get a tutor, all right?
Right.
You're the one that's teaching us. We have
Exactly.
one
Yeah,
minute.
but changing their lives is they show up 80%. I just contribute the information, but they're the ones who do it.
And you provide motivation for them
Yes.
and the commitment.
Yeah.
I'm going there. And I'm
Yeah.
there. I want to make this really work. We got 1 minute left. right?
Okay, well,
You're going to sign us out, and I would like you to say something to some young lady that's out there about 18 years old. All right, she's wondering what she should do. All right, so why don't you talk to her today about success and about her future? And what camera should she look at? Right over here. You're gonna look right.
Oh, right
in
there,
that
sorry.
camera.
follow your dream because that's what brings happiness. And it's very important to chase your dreams. Do it.
Perfect.
Do
And
it.
we're going to go around the room real quick, and then we're going to sign out. Why don't you say your name for everybody again?
I'm Dr. Erica Nelson, and I'm a licensed physical therapist.
I'm Alina Klein, a realtor, Florida, Miami.
Okay, Lena, thank you.
Thank you.
Dr. Nelson,
Thank you for
being
coming.
here. Folks, thank you for your time. We appreciate it. Stay healthy and have a great day.
Have a
And your
great day.
facelift.
That was awesome.